Real Country 1430 AM and 1073 FM WRDN. I'm Brian Winnekins, and joining us this morning is Pepin County Health Officer Heidi Stewart as we talk about the recently released county health rankings. And this was something that is done by the University of Wisconsin. And Heidi, thank you for joining us this morning to talk a little bit about it. So, how does the University of Wisconsin do this? Is this part of do they take the information from the community health survey that the health department does with Advent Health, or how do they get this information to make these rankings?
Yeah, that's a great question. So thanks for having me today, Brian. The community health rankings are something that have been done for many, many years. Initially, it started in the state of Wisconsin. It is done through the university, funded by the Robert Wood Johnson Foundation. They started really small, and in Wisconsin, they looked at every single county and some specific metrics as to how to rank health outcomes and health factors. And I am sharing my screen here today, so I'm going to go ahead and pull this up quick. Now this is expanded quite a bit. This is a look at what they look at today for health outcomes and health measures. Initially, several years ago, it started out small. Not only have the inputs that they look at expanded, but the use of this tool has expanded. It's actually being done now in all states, in almost every single county throughout the United States. So it's a pretty extensive tool, and it's being used in an extensive way for people to be able to measure their community health. So you can see here a few different things that they look at. They look at health outcomes, health factors, and then there's different policies and programs. Within the health outcomes, the two measures that they look at are length of life and quality of life. Length of life is pretty straightforward how they measure that. Quality of life is based on a self-reported tool called the Behavior Risk Factor Surveillance Survey. If you go to this website, which is countyhealthrankings.org, you can actually, this is a kind of a interactive tool site graph. I'm sorry. This is an interactive graph right here, where if you want to look at specifically what they measure when they look at length of life, you can click on it and see that they're looking at premature death, life expectancy, and mortality measures. Quality of life, they're looking at poor or fair health days, and of course these are self-reported. Low birth weight, that's not a self-reported thing. That comes off of a specific tool. So once you click on that, you can see here, quality of life. Low birth weight, click on low birth weight, and over on the left-hand side of the page, it tells you where that measure came from, how it's gathered. So every single one of these categories has that explanation. If you have some time, and if this is something that's interesting to you, you could spend a pretty substantial amount of time on this website.
And I know that the website, obviously they do have the county by county rankings, and so what they did then was they take all these different factors, again, not just how many people smoke, but they take in other factors like childcare and access to health care and access to broadband and things like that. And that's kind of how they came up with these rankings, right?
Yeah, and interesting that you mentioned access to broadband. That's one of the newer factors that are actually in here. This year's focus for the health rankings, and it's health rankings and roadmaps. So roadmaps part is what we're supposed to take as a community and address and move forward to improve our ranking. This year, we're ranked 27 out of 72 counties. We have, since 2011, is as far as it goes back, we have been everywhere from number 2 in 2015 to number 55 in 2012. In the past, because of our small size and our small cohort of individuals being questioned on the telephone surveys, our ranking really fluctuated quite a bit. The last couple of years, when they're adding more and more measures to it, we're seeing it stabilize a little bit. So 22, 30, 37 is where we've been the last 3 years. I think it's important when you look at this to look at the health outcomes. Of course, we want to be in that 75 to 100% ranking for healthiest counties. That's what a preferred preference would be. But what we really need to look at and we really need to start working on is the health factors. We definitely don't want to be down in the least healthy as far as behaviors and factors that influence the outcomes.
And so some of the biggest things, I guess, for us with some of these health factors that what were some of the biggest things that made those health outcomes? It's not the least healthy, but it's one step above that.
Yeah. So what I also really like about the website and the tool is it shows us areas to explore. So if we go ahead and click on that, you can see here premature death, and I just did the mortality surveillance for the state. For the county this morning at our Board of Health meeting, and our average age of death for residents is pretty close to that of the nation. So right now the nation's average expected life expectancy is around 76, which is lower than what it had been previously. It was closer to 80 in prior years. So if you look at this tool, you can see some of the things here where we rank, and we're really pretty stable. We're pretty comparable with the state of Wisconsin and the United States. When you get down into the health factors and you start looking at some of the items down here, they definitely rank us worse in smoking, adult obesity, things like physical inactivity not physical activity, I'm sorry. Access to exercise opportunities probably brought us down a little bit, and excessive drinking. One of the areas that I think it's not highlighted by the tool, but 43% of driving deaths in Pepin County had alcohol involved. That's something I think we definitely can do better. There's other things as you scroll down and look. We were very fortunate in the past year or whenever this ranking came out that we didn't have significant overdose deaths, so that's not coming up in there. But in general, in the United States, they believe that the cause for the decrease in life expectancy is directly related to overdose deaths, particularly those associated with fentanyl. I was at a meeting earlier this week of the local emergency planning committee, and we had a representative there from Menominee, and they had 2 overdose in the last 24 hours in Menominee, right next to us. So I'll let you ask another question. I'm sorry.
Talking with Pepin County Health Officer Heidi Stewart about the county health rankings that were recently released by the University of Wisconsin. You can dig into all of this as well at countyhealthrankings.org. So Heidi, when you look at some of these all these factors, and it's not just the overdoses, but it's health insurance and social and economic factors like childcare and things like that, and you have this roadmap. What's the roadmap saying to you that the county has to work on to maybe increase our ranking?
Yeah, so I think this is a really great tool. I think it lays out information for counties, for individuals, for organizations. And I like the fact that it compares Wisconsin, United States. You can compare our county to other counties. But really what we need to do is look at it, dig down into the information, and make sure that the measure that they're showing us is correct. A lot of the information in here is self-reported by telephone surveys. And if the individuals, the small, sample size that they take from Pepin County, if those answers that are related to self-reported aren't really representative of the whole community, it might not be a true report. Another thing to look at is the fact that some of this is based on statistical modeling. which when there's the statistical modeling that's done, there's assumptions that are made, and those assumptions might not always be correct. So really looking closely at it, looking at the trends over time, which if you're looking at the map, you can see that sometimes they'll show trends. One of the trends that I am able to pull up here on the screen is mammogram screening, and Pepin County's always been better, but it does show us that we're starting to trend closer to the number of Wisconsin and the United States. So that's something that, even though we're doing really good at it right now, we want to make sure we continue to do good at. I think it's really important that we do participate in local surveys. At the beginning of our discussion, you talked about the survey that was done by Advent Health. I think it's important that as organizations, we get together and talk about what we're seeing. Last year, we had a staff member do some key informant interviews of law enforcement, district attorney, school liaison officers, to talk about what are you seeing? Is what we're hearing about in the news and in reports such as the county health rankings the same as that what the boots on the ground are seeing for our communities? And then taking a combination of those local reports, the local interviews, what we learn locally, and combining it with this great tool, and then coming up with action plans, I guess.
Talking with Pepin County Health Officer Heidi Stewart this morning, talking about the county health rankings. You can look at all of the information. There is a lot of it at countyhealthrankings.org. And Heidi, good. I just change the shift gears here a little bit. And it's related to this. Okay, so you have this roadmap, and part of the things that, and some of the stuff that the health department had been doing, of course, all of that stuff got interrupted because of the COVID situation. But now the health department's starting to bring back a lot of different programs that had to be put on hold because of COVID, right? So you're kind of getting back to, I guess, quote unquote, normal again.
Yeah, but for us here, it truly is not the same old normal. We took this opportunity to kind of do a reset, if you will. We looked at the programs. I'm going to go ahead and stop sharing the county health rankings screen there. We looked at the programs that we were offering prior to COVID, and what we stopped during COVID, and really did an analysis of what we maybe needed to continue or what we needed to discontinue. There are some programs that we're not going to be continuing. There's some programs that we're going to be taking on. So food safety and recreational licensing is a really big one that we're looking at, and working with DATCAP and some of the surrounding counties to take that back. I know probably early 2000s, 2003, 4 maybe is when we discontinued that program. Locally, we're going to go ahead and take that back. We're also going to be looking at taking back a program from the DNR, so water testing. It's currently being done by Dunn County for Pepin County, and with the increase in staff that we have here, we're going to take that program on. Some of the positive, there are some positive things that came from COVID. One, I think, is the access to be able to have meetings and converse and watch distantly, participate in local events from distant locations. Another positive is some of the carryover funding that we've been receiving. It really has allowed us to hire some individuals at a higher FTE than we previously had. I think that will help with some of the retention. And we are using that supplemental funding right now to examine and take over these programs so that those positions can remain at the full FTE and be sustainable without the use of tax levy dollars moving forward. So we're really pretty excited about that.
Heidi, you mentioned, pre-COVID, attending events and things like that. And, January of 2020, no one knew what Zoom was. You'd actually come down to the station to do an interview with me face to face, and now we can do this via Zoom and that sort of thing. Is that something that the health department is potentially looking at for some programs where, like maybe WIC or programs like that, where normally I would come in, or but now I can just, or if I need some type of service, I can schedule a Zoom meeting with someone from the health department right from my home.
Absolutely. So during COVID, the WIC program, which is the Pierce Pepin WIC program, and it's run by Pierce County, they transitioned to 100% remote, 100% televisit for the WIC participants. They are now offering in-person visits if people would like to be in person, but it's up to the individual, the family, whatever works best for them. So that's really turned into what a hybrid option for WIC. We also have some of those same options for our reproductive health and family planning, and those are some things that we're working on expanding. We did use telehealth during COVID for those visits. There are, of course, some things that just need an in-person visit, but if we can do the visit telehealth or by Zoom, and we can do it in a secure, confidential manner, we certainly are looking at those options.
And it would seem to me then that with the programs that you have, it might make it easier for the department to be able to have some other programs, again, like water testing. Well, obviously I have to come down and give it to you, but there might be some other things that, hey, you know what, we could do this, we never did it before, but we could do this because we could just do this hybrid or via Zoom, because it'll make it a little bit easier.
Right. I think looking at all the ways that we can be efficient, and as that's one thing, assessing what the community needs are. Can we do this efficiently? Does this make sense? Are we duplicating work that's being done by another agency in the community? For a long time, we've used the philosophy that it doesn't make sense. We're not here to compete with other people for providing services. So really, we look at the gaps and we fill those gaps. And a lot of times what we find out is that we fill the gaps and then somebody else comes in and they're able to take care of the program long term. And then our time filling the gap is done and we move on to something else. So it's always changing at the health department, always looking for new ways. Very excited about some of the work that we're going to be doing with you, WRDN, Career Wedge, some of the gas station TV opportunities to do some more promotion and getting the word out more about the services that we offer. That's another big project that we've been taking on.
And quickly, we had Jeannie in for the Smart Talk. Is that one of those type of programs where that could be something that it's a Zoom thing where health department and could help work with parents even more on a smart talk with their kids about alcohol and expanding it to vaping and smoking and those sort of things?
Yeah, so the program that we have, it's a very, very small amount of funding, is not necessarily intended to do coordination or family health education visits. It's more intended to plant a seed in people's minds about opportunities and things that they can do. So that particular project is more for information sharing and is intended to get people thinking about their behaviors, how they can potentially talk to their children, and just keeping their eyes open about some of the things that our children are facing.
Well, again, Heidi, we appreciate you joining us this morning. That's Heidi Stewart. She is the Pepin County Health Officer with the Pepin County Health Department. You're listening to WRDN.